Technology is actually a very big part of facial rejuvenation and cosmetic practices. And every other day we feel like we're being introduced to a new technique, whether it's a new laser, whether it's a completely new concept like radio frequency or chemical peels or anything that we hear about. And there always comes with a significant number of claims of being the newest and the next best thing, and it's going to do miracles and all this other thing. And usually what ends up happening is within a 1 or 2 year period after it's hit the market, the truth really comes out, whether it is as good as it claimed to be or not. But by then, unfortunately, it's often too late, because most patients and most practices take advantage of this increased swell of marketing and in fact, in some levels, propaganda, and participate in these procedures, only to find out shortly thereafter that many of them don't work, or that they have, the claims aren't met. And then what ends up happening is that those particular products end up becoming obsolete, and then they go, and then the new generation comes up. And a very specific category is the radiofrequency microneedling devices. Now, microneedling is a simple concept where you take a high-frequency needle and you poke a bunch of holes into the skin. And what those holes basically do is they create injury to the surface of the skin. And that injury creates a cascade of signals to the deeper parts of the skin that says, hey, we've just been injured, and therefore we need to create more collagen, and therefore we need to build more proteins. And as a result, the skin starts to get thicker. And that's a good thing. That's what we want. So we love the idea of any type of superficial injury to the skin, whether it's mechanical, like in the case of micro needling, whether it's lasers, whether it's chemical peel. Now, what they've done is they've taken micro needling and associated it with a bipolar, with energy. So the energy basically creates an even deeper, even more substantial injury to the skin. And the idea is that will cause more of a shrinkage to the skin and an improvement in the overall texture and quality, improve pore size, crepiness, etc. Now, that particular approach comes in a variety of different forms. Now, I'm personally a big believer of any type of repetitive skin injury. I'm a big fan of that. So if you want to add radio frequency to it and make it a little bit more effective, I'm all about that. The problem that I have, based on the anatomy, is if the energy gets too deep, the skin is only less than 2 millimeters deep in the face. If the energy gets too deep, now you're attacking the subcutaneous fat, and there's fascia at that level. So what ends up happening is you start to lose and potentially devoid the skin of some of that valuable fat that's underneath it. And that fat is what gives the skin that suppleness, that softness, and it's a very attractive look. And when you lose that fat, your skin appears more thin, and everything starts to look like it's starting to cave in a little bit. So the particular device that I'm thinking of right now that's gotten a lot of traction is the Morpheus 8. And Morpheus 8 is a microneedling device with radio frequency, but what it does is it has a deeper level of energy deposit, so down to 4 millimeters, down to 8 millimeters, depending on the settings. And as a result, what you're trying to do with that is you're trying to tighten tissue, and that's the claim that is happening here. But the problem is, again, as we talked about, that energy being deposited into the deeper layers means that there is an injury potential to the fat layer, which is not exactly what you want. So even there might be a temporary constricting quality to the skin, unless you're actually physically working on lifting the fascia and removing the excess, you're not going to get a long-lasting change. But as a risk you're taking is you're going to cause injury to some of the vital tissues that you don't want. So personally, I'm not a fan of that. I actually looked very deeply into this entire category, and I've decided to go with a category that doesn't have the deep penetration, that's mostly confined to the level of the skin, and that will allow the skin to get the benefits without causing the negative side effects. And just as a general point of view, I am wholeheartedly opposed to any type of technology at this moment that claims that they will tighten tissue and tighten skin. I have not seen it so far. I don't think we're going to see it, because once you see what is actually happening at the deeper anatomic layer, you realize that it's very hard to be able to establish the type of facial shape change that happens on the fascial layer with a topical solution like a technology like a laser or a radio frequency device. I hope that helps answer the question. I know it's a little bit more detail, but I think it's important for you to understand the logic behind that. So a common and very important question that comes up is, how long does the vertical restore last? The vertical restore is a technique that I developed and trademarked, and it is something that was born from the desire to make an exceptionally long-lasting outcome from a facelift, and that was one of my big desires. So how long does it end? The simple answer is it's 10 to 15 years. How does that compare to a traditional facelift? Traditional facelifts, or the SMAS facelift, typically can last anywhere from 3 to 7 years. So the vertical restore is significantly longer than that. And why that is because it incorporates a category of facelifting that has been around for 40 years that's called the deep plane. The deep plane is an approach that is very advanced in terms of how it's performed. What it does is it enters a level of the tissue that is basically a cleavage plane where the tissues slide with aging. And what we do at that level is separate all the important ligaments that are holding the skin and fascia down to the bone. And when we separate them from this cheek area down to the jaw area, and the vertical restore takes it even a step or two further, separates it from the neck area, what happens in those cases is you get complete freedom of the fascia, which has been elongated with age. And with that movement, what ends up happening is you're able to move the entire face without any opposition. There's no counter tension to that. And that's a very important point, because if you were to try to lift the face while those ligaments are attached, what you end up feeling is resistance. And that resistance, then you try to pull against it, and what ends up happening is there's counter tension like a rubber band that starts to defy the changes that you get on the operating table shortly after. That's why the longevity of many of these techniques are not quite the same. But when you completely release the face, unopposed, lift it to where it wants to be, and then reattach everything, you get a very soft, very unpulled look, a very smooth outcome without that tense, stretched look that you get with traditional facelifts. But really beautifully, you get something that has zero tension across the mobilized segment, and that gives you the longevity to it. Plus the fact that you've moved so much more tissue than you get with a traditional lift. So those are the fundamental differences and benefits of the vertical restore, allowing us to get a very long-lasting result. I hope that helped explain that. If there's any other specific questions you'd like answered, please put in the comment below. And as always, please subscribe to the channel to get more information and more frequently asked questions answered. Thanks so much.